I'm here with Dr. Rachel Malloy, a nurse who has curated the Media Competency Training Program for Nurses, now available through the American Association of Neuroscience Nurses. What inspired you to create a media training program for nurses?
Well, studies have shown that the nurse's voice is missing in the media, where they can have the greatest impact on population health. And what media training does is it provides those tools, skills, and really the confidence to allow nurses to speak to the media and be engaging.
So, when you say media, what kind of media are you referring to?
Oh, that's such a good question. Media comes in many forms. It can be letters to an editor, an op-ed, podcasting, blogging, or interviews such as television or radio. It can be something as simple as writing a health news story for your local newspaper or magazine, or sending a letter into the newspaper to express your opinion, the nurse's perspective on a healthcare topic.
So, what's unique about this media training program?
I built this media training program. It's based on science, and the foundation is the 10 media competencies for nurses that were published in a Delphi study in 2022. So, all references, all examples, and the activities that support the learning all have a neuro reference to them. So, it really will speak to the heart or the brain of that neuroscience nurse.
So, can you elaborate on why each nurse should take a media training?
Yes. So, nurses have been ranked the most trusted profession for over 20 years, and they advocate every single day for their patients using therapeutic language. And all we're really asking nurses to do by engaging with the media is taking what they're already doing one on one with their patients and sharing their knowledge and expertise at a greater level so they can impact their communities more broadly.
As nurses, we are comfortable talking to our patients, but then a more public forum can be intimidating. What would you say about that?
Yeah, I totally understand that. You remember the first time you started an ID? I mean, it was scary, right? I mean, we'd never done it before. Are we going to do it right? Are we going to hurt the patient? But with time, with skill, and with practice, we've really honed in our skills and became experts in our field. And it's the same thing with media engagement. Let me share a story with you. So I recently talked with a nurse who was asked by her healthcare system, her hospital, to record some interviews on signs and symptoms of stroke. And she was really uncomfortable doing it, but the hospital asked her to do it, so she did. And then this got played, and aired on news stations and all over. Well, then she noticed that patients were coming into the hospital with stroke and they were recognizing her, and she started getting recognized as the stroke lady. And then her patients started feeling more comfortable and confident. They were like, "Oh, you're the lady from TV." And it really made them feel better to know that they recognized the person that was caring for them.
I love that story. And it exemplifies how, as nurses, we're really positioned to have a unique kind of engagement in the media. So, for all, a health news story is not complete without the voice of a nurse.
Ah, that's so true.
So, where can we take this training program?
Sure. The Media Competency Training Program for the Neuroscience Nurse is available through the American Association of Neuroscience Nurses. You can access it at AANN.org. And it's $100 for members of AANN, $150 for non-members, such a bargain. And you get 3 continuing education classes. So very excited for people to take the program and see how it speaks to them.
Well, that is fantastic. Thank you so much for creating this media competency training program, Rachel.